Good evening, friends. Now we are going to discuss high yield questions of psychiatry. Myself, Dr. Ankur Jain, psychiatry faculty. We start very first question. Yes, that is a 34-year-old woman suddenly experienced difficulty in breathing, okay, dizziness, tachycardia, shakiness, feeling of terror. Means these are anxiety symptoms. So suppose I am sitting and suddenly start having anxiety symptoms. The first thing which will come in your mind, that panic attack. Okay, if we talk about the psychiatry. But suppose this anxiety is so severe, I feel that I may die, I will go crazy. Yes, there is feeling of impending doom. What I said, feeling of impending doom, feeling of impending doom. I will die, I will go crazy. Wherever you find these terminology, this is panic attack. Panic attack. But before making the diagnosis of panic attack, you will rule out organicity. Just like in this question, they have mentioned that all investigation, ECG, investigations, cardiovascular, pulmonary, other illness, all has been ruled out, then you will make the diagnosis of panic attack. In anxiety disorders, you will find they gave so many phrases in previous year questions, and phrases are the catching point. So again I repeat, feeling of impending doom, I will die, I will go crazy, panic attack. If this panic attack is occurring again and again for more than 1 month, then it will become panic disorder. So in this question, that these symptoms are there, they are sudden, and patient has feeling of impending doom or die due to heart attack. All investigations are normal. Yes, patient also have additional 5 or more than 5. Yes, very good answer is Akshat. C. Episode resolve quickly each time for last 3 months, more than 1 month, diagnosis is panic disorder. Got the point? 2-3 times same question, little bit modification in the description. Claustrophobia, frequently asked question. Phobia means excessive and irrational fear of thing. Okay, if you don't remember the definition, you know the phobia. Claustrophobia, C for claustro, C for closed space. Closed space. Agoraphobia, fear of market, fear of market, fear of closed space, fear of open space, fear of those places from where escape is difficult. So if question is asked and they give only and only closed space, then the answer would be claustrophobia. Question has been asked. If they give fear of closed space, open space, fear from where escape is difficult, the answer would become agoraphobia. Social anxiety disorder, previous name ICD-10 was social phobia. Social phobia. So in this question, answer is C. Next question. I told you many times you will find phrases in anxiety disorders. In anxiety disorder, just like generalized anxiety disorder, there is free floating anxiety. Free floating anxiety. Although in this question they have not given this phrase, but they have given that anxiety all time. Every time there is anxiety. You can mark yes, please comment the answer. Anxiety all time. Patient is anxious every time. This is generalized anxiety disorder. हवा में बह रही है anxiety और तुम catch कर रहे हो. Okay? Women complaining difficulty in initiation of sleep. Point it out. Although not diagnostic, but जहाँ पे anxiety disorder होता है, wherever anxiety disorder is there, generalized anxiety disorder is there, you are lying on the bed and you are thinking about the next day, you are worrying about the next day, you are having anxiety of the next day things, so you will not be able to initiate the sleep. But in depression, you find, yes, you find early morning awakening. Question has been asked, early morning awakening. That is, yes, Parth, Akshat, correct. Waking up at 2 hours prior to normal awakening time. That is early morning awakening seen in depression. So in this question clearly given, yes, thoughts that her parents may die in an accident. Similarly, other worries, so many worries are there. anxiety all time. The likely diagnosis is generalized anxiety disorder. Duration of symptom should be 6 months. G looks like 6. Okay, sometime question is asked. Other option you will rule out: adjustment disorder. Adjustment disorder may also have anxiety symptom, but there is no stressor. In adjustment disorder there is stressor. Okay, and diagnostic criteria of generalized anxiety disorder will not be fulfilled. OCD, different scenario I will discuss later. Panic disorder we just discussed. Okay, all anxiety disorders, in all anxiety disorder or most of the psychiatric disorder, you will find that treatment is CBT. Yes, treatment is CBT plus SSRI most of time, except phobia. Phobia, BT, behavior therapy plus SSRI. Question has been asked. Hi, Pawan. Next, 35-year-old man was taking medication for depression, but he had sexual dysfunction. Which drug? Yes, please do comment. You know, antidepressant with the least sexual side effect, bupropion and mirtazapine. Both question has been asked. Agomelatine. Although question is not asked till now, but agomelatine is also devoid of sexual side effect. So escitalopram, SSRI, you all know. SNRI, yes, tricyclic antidepressant. These are antidepressant having sexual side effect. Bupropion, in this you will give. Okay. Question is asked, antidepressants are chosen on the basis of, yes, please, chosen on the basis of, this question has been asked, partially on side effect profile. Yes, this is recent update. Previously we used to say that antidepressants are chosen totally on side effect profile, but now we started saying this is partially. Okay, synopsis, latest edition, this is given. Question may be asked. Now, I will tell you a few questions. If a patient came to me having mild depression, recently asked question in FMGE, mild depression, yes, you will do CBT, cognitive behavior therapy, okay, plus mild exercise, okay. Moderate to severe depression, CBT plus SSRI. Yes, CBT plus antidepressant, and most commonly used antidepressant is SSRI. Okay. Now, depression with suicide. Wherever you find the word suicide, without second thought, you will mark the answer. Yes, do comment. Modified ECT. Modified ECT. Why it is said modified? Because we give general anesthesia and muscle relaxant. Question has been asked. General anesthesia, methohexital, muscle relaxant, succinylcholine. Okay. So, depression with suicide. Now question is asked. Yes, you will give me answer. Yes, aerobic exercise. Yes, aerobic exercise in which you have touched this point. I will elaborate. Now exams are approaching and you will find little bit anxiety. Some mood disturbance would be there. Some sadness would be there. Question is asked that cortisol level, increased cortisol level is found in 50% patient of depression. You are in stressful situation. Yes, definitely. Exam is a stressor and you are in stressful situation, and in this cortisol may increase, so you are predisposed to depression. So if you do regular exercise, trust me, you will never be depressed. Your energy level will increase because it's a part of treatment also. So do regular exercise, aerobic exercise. Okay, dear? Yes. See, any exercise you can do, but I feel that if you do aerobic exercise, this will give you a little bit more energy throughout the day. Early in the morning, you should do that. Now, a question is asked, depression with suicide plus pregnant woman. What should be the treatment? In pregnancy, you should give ECT or not? Please do comment. Yes, ECT is safe in all trimester. All trimester ECT is safe. Okay. Depression with psychotic feature. Depression plus psychotic features are there, antidepressant, psychotic feature, antipsychotic, antipsychotics, antidepressant plus antipsychotics. Now, if patient is not improving, you will give modified ECT question. So they will give a clinical scenario. According to that, you will find the answer by this chart. Okay. Next question. So frequently asked, they are asking on suicide. Yes, a patient diagnosed with severe depression. If patient of severe depression may have suicidal ideation, suicidal ideation. Patient may have very low energy, very low energy. Now you started treatment. Patient is improving. Energy is improving, but suicidal ideation is still present because energy level improves first, then suicidal ideation. So whenever we start treatment of depression, yes, we will keep in mind that we will not discharge patient in recovery phase. In recovery phase, he will get energy, he will go to the market, will buy a rope and hang himself. Previously, when energy was low, suicidal ideation was present, but he was not having sufficient energy to commit suicide. But when he started recovering, yes, he may commit suicide. That's why we say that this is paradoxical suicide. This is paradoxical suicide. Very good, DK. Yes, suicide in recovery phase. Suicide in recovery phase. So at the time of discharge, we are concerned with suicide risk, not about ECG monitoring. Yes, in tricyclic antidepressant, if you start tricyclic antidepressant, you do ECG monitoring at the time of increase the dose. So when we discharge the patient, we don't increase the dose. So in this, answer is suicide risk. Okay. Most common cause of suicide? Yes, depression. Most common cause of death in schizophrenia? Yes, suicide. Complete suicide is more in males. Attempt suicide is more in females. Yes, it means that they don't want to commit suicide. Females want to commit suicide, but they try to use a little bit less painful methods. Okay, that's why attempt suicides are more in females. But medico-female, complete suicide is more, because medicos are a little bit wiser, you know. Yes, most common age of suicide, adolescence, okay, plus old age. Okay, sometimes question is asked that middle age female, suicide rate is very high. Yes, depression with suicide, treatment of choices. Yes, ECT. I have already discussed. Clear? Now, yes. Identify the mental health disorders shown in this. So, this is a potential question. ICD 11 has classified bipolar affective disorder in BPAD 1 and BPAD 2. Yes, BPAD 1 and BPAD 2. Mnemonic. 2 looks like H, hypomania. If you find hypomania only, the answer is BPAD 2. If mania, then it is BPAD 1. Okay, so you make mnemonic. If question is asked, they gave multiple episode and they gave that there is mania. Without second thought, you will mark the answer BPAD 1. Why I am saying like this? You tell me. There is a patient having depression. Depression is coming again and again. Recurrent depressive disorder. Okay. Now, a patient came to you having mania. Please give me answer. What would be your diagnosis? Option A, recurrent manic disorder. Option B. Yes, very good, DK. Yes, recurrent manic disorder, BPAD 1. So answer would be BPAD 1. So if again and again many are there, this recurrent manic disorder is not a diagnosis in psychiatry. The answer would be BPAD 1. So in this question you can easily see that there is depression, there is mania, there is subsyndromic depression. What is this? I will discuss. Depression, hypomania. So in this depression, mania, if mania is there, without second thought, answer is BPAD 1. Clear? What about the other option? Suppose the same question I take and patient is having fluctuation in mood, but never fulfill the criteria of mania or hypomania or depression. Means fluctuation of mood is there. Yes, I usually make mnemonic. You have seen your HOD. In the morning you go, he becomes so happy. Yes, such a brilliant boy, and he will praise you. In the evening or afternoon, you meet him happily and he start scolding you. Means his mood is fluctuating, but he is not having hypomania, he is not having mania, he is not having depression, but mood is fluctuating, and it is fluctuating for very long time, at least 2 years. At least how many years? 2 years. So if mood is fluctuating, yes, happiness is there, excessive sadness is there, but not fulfilling the criteria of depression or mania or hypomania, diagnosis would be cyclothymia. Okay, dysthymia means depressive symptoms are there. Yes, but never fulfill the criteria of depression. Very, very important. So many questions are asked. I will make a flow chart. Yes, and trust me, it will help you to solve many questions. Okay. You all know symptoms of depression. Yes, you all know the symptoms of depression. Mnemonic is EMI. First mnemonic, yes, EMI. Energy, mood, interest. So many questions are there. One question is very common from this topic and they try to confuse you. So energy, mood, interest. Low energy, sadness of mood, decrease interest. Other than guilt, decrease appetite, decrease sleep, suicidal ideation. Out of so many symptoms of depression, if 5 symptoms are there for 2 weeks, 5 symptoms for how many weeks? 2 weeks, diagnosis is depression or major depressive disorder. But suppose a patient came to me having only 3 symptoms, 4 symptoms, means he is having appetite, decreased sleep, sadness of mood, 3 symptoms are there, depressive criteria not fulfilled. Depression diagnosis is made only when depression criteria 5 symptom according to DSM-5, 5 symptom for 2 weeks. Suppose a patient is having only 3 symptom, 4 symptom, I will not make the diagnosis of depression. These symptoms continue for 2 years. Diagnosis would be dysthymia. Yes, you must have seen few of your friends. जो टॉपर होता है फ्रेंड, तुमने देखा होगा कई बार MBBS में 10 गोल्ड मेडल लेके बैठा है, फिर भी दुखी है, दुखी आत्मा कहते हैं जिसे। वो दुखी है कि मुझे बाकी के गोल्ड मेडल क्यों नहीं मिले, वो खुश रह ही नहीं सकता। उसे डिप्रेशन नहीं है, डिप्रेशन होता तो वो गोल्ड मेडल ले ही नहीं पाता। तो दिस इज डिस्थाइमिया। ओके, यू कैन रिमेंबर लाइक दिस। ओके, तो ये तुम्हारा दोस्त जो 10 गोल्ड मेडल लेके बैठा है, डिप्रेशन क्राइटेरिया फुलफिल नहीं करा, डिस्थाइमिया। तुम्हारा HOD जिसका मूड फ्लक्चुएट होता है 2 साल तक, यस, दैट इज साइक्लोथाइमिया। BPAD 1 mania, BPAD 1 hypomania, BPAD 2. Now in the same question they give that, yes, you will find they've changed only 1 word or 2 word and answer is changed. In the same question, if they give these episodes occurred in last 1 year, Means one episode, second episode, third episode, four episode. 4 episodes in 1 year, that is rapid cycler. Again I repeat, rapid, I write here, rapid cycler. Or char, if 4 or more than 4 episode, then it is rapid cycler in 1 year. Okay, and the best drug is valproate. Okay, now these depressive symptoms, yes, these depressive symptoms may be present after breakup, divorce. If depressive symptoms after breakup, yes, after breakup the girl is very sad or boy is very sad, okay, symptoms of depressions are there, but depressive criteria is not fulfilled. What I said, depression criteria not fulfilled. Please comment what is the diagnosis. What is the diagnosis? Yes. Yes, the answer would be adjustment disorder. Adjustment disorder. Means if in the same question, yes, I give you a question, a patient is having sadness of mood, decrease appetite, decrease sleep, after breakup, what is the diagnosis? You made the diagnosis, adjustment disorder. In the same question, they added that mood is low, energy is low, interest is low, appetite is low, less, sleep is less, 5 symptoms are there, more than 2 weeks, diagnosis is depression. So adjustment disorder is diagnosis of exclusion. Many times they will give depressive symptoms and they will try to confuse you after breakup. If after breakup depressive criteria not fulfilled, diagnosis is adjustment disorder. Diagnostic criteria fulfilled, diagnosis is depression. Got the point? Clear? Now, which of the following mood stabilizer has anti-suicidal property? Please do comment. Yes, anti-suicidal property. Lithium. And one more drug, clozapine, antipsychotic. Antipsychotics. Clozapine is having anti-suicidal property. Both are questions. Okay. Now, a 27-year-old female having bipolar disorder was on lithium. Lithium so frequently asked, so you must know few important points about lithium. Yes, lithium is excreted by kidney. It is excreted by kidney. So whenever you start lithium, always do kidney function test. Why? If kidney is not functioning properly, definitely there would be no clearance of lithium and lithium toxicity may be there. Lithium is having very narrow therapeutic index. Question is asked. Yes, therapeutic dose is 0.8 to 1.2 milliequivalent per liter. Yes, this is therapeutic dose. If one more than 1.5 milliequivalent per liter, then it is toxicity. So such a narrow therapeutic index, if a person is there who is on lithium and kidney is not doing properly work properly, definitely lithium will accumulate and will produce toxicity. Okay. And if lithium toxicity is there, yes, definitely you will do dialysis. Why? Because function of dialysis is to bypass kidney. Yes, so if kidney is not working, you do dialysis and lithium is excreted by kidney. So yes, in lithium toxicity we do dialysis if more than 4 milli equivalent per liter. Or what are the symptoms of lithium toxicity? Yes, so this statement is absolutely wrong. Hemodialysis is given as treatment when lithium level is 4 milliequivalent per liter, more than 4 milliequivalent per liter, or severe symptoms of toxicities are there. Okay, so this is the answer. Yes, what are the severe symptoms of toxicity? Those are vomiting, yes, abdominal pain, coarse tremor, point it out, ataxia. Now you will forget, I know. That's why I usually make a clinical scenario. Suppose a patient of bipolar disorder or mania came to me and I started lithium. I will start lithium and will measure lithium after 5 days. How many days? After 5 days. Question was asked that you will check serum lithium after how many days of starting lithium? After 5 days. When you will take sample, you will take sample after 12 hours of last dose. Suppose he took last dose in the night at 9 p.m. You will take sample at 9 a.m. So both are questions. Suppose this patient is on lithium, came to you, you will ask patient to stretch hand. If after stretching tremors are there, these are fine tremors. These are normal side effect of lithium. What I said, fine tremors, side effect of lithium, side effect of lithium, and you will give beta blocker. But if coarse tremors are there, yes, this is indicator of lithium toxicity. You will check reflexes. Hyperreflexia would be there. Ataxia would be there. Patient may be in coma, death. That's why if these severe symptoms are there, you will do dialysis. Clear? Very good, DK. So lithium decreases thyroid function. Yes, thyroid function disturbance is there in lithium. This is true. Thiazide increase lithium toxicity by decreasing its clearance. This is true. Lithium is avoided in pregnancy due to teratogenic effect because it cause Epstein anomaly. All the points I am telling you, these are recently asked question in your FMGE. Okay, Epstein anomaly. Before moving further, I will point out valproate neural tube defect. Suppose a pregnant woman came to you and I ask you which drug you will give. I give you only two options, valproate, lithium. You will never give valproate. You may give lithium but will never ever valproate because the chance of neural tube defect is very, very high. Okay. So many times in neurology, medicine, questions are asked, they give clinical scenario. That scenario suggests that you should give valproate. And they will give that the lady is in childbearing age group. What I said, childbearing age group. In childbearing age group female, we never give valproate. If you give, there are chance of neural tube defect. So it should be, valproate should be avoided. Got the point? So this question has been asked. Yes, which drug should be avoided? Option A, valproate. Option B, lithium. The answer was valproate. Although lithium should be avoided also, but one to choose, then it is valproate. Okay. Next, you can tell me the answer, please. Familiar person is cheating. Yes, I give you two because these two questions were asked in 2018, back to back in the same exam. Yes, Capgras and Frigoli. After that, so many questions on this same topic. Yes, you will remember the example. Frigoli syndrome. There is a patient came to me, Doctor Saab, you know, the beggar sitting outside my flat is not beggar. He is my boss. He is keeping eye on me. Wherever I go, he follows me. Yes, yesterday I went to post office. He changed his physical appearance just like a postman. Yesterday he stopped me at red light. He was looking just like a policeman. He changed his physical appearance just like policeman. He can take multiple physical appearance. Yes, so this is typical example. Yes, very good. Office boss, beggar, very good. DK. Yes, so he is taking different physical appearance. The same person, patient believe that a familiar person, yes, my boss, is changing his physical appearance. Just like beggar, postman, policeman, and he can have multiple different appearance just like changing face mask. Yes, okay. So just sometimes you will find this image based question, answer would be Frigoli. Now what is Capgras? You must know at the same time. You will remember the example. There was a lady. She used to say that my husband is not my husband. He is somebody else. He is somebody else. He's looking just like my husband. He's behaving just like my husband. He's talking just like my husband. He's walking just like my husband. Okay, but he's not my husband because he is wearing cap. Mnemonic. He is wearing cap. Means cap grass syndrome means familiar person. Familiar person. Husband has been replaced. Has been replaced. Yes. Replaced by similar looking stranger. Okay, sometime in clinical question they will give that he is beating her husband, saying that you are not my husband, you have changed your physical appearance just like my husband. Okay, yes, means you are looking just like my husband, but you are not my husband. So these are quite similar. Okay, but when clinical questions are asked, you will solve these questions by remembering the example. Trust me, you will be able to solve question. Okay. Okay, thank you, DK. Yes. 40 year. Yes, before going to this question, I will make a flow chart. I will make a flow chart will help you to solve many clinical questions. If in question suspiciousness is there, immediately you will see that this suspiciousness is firm. If firm means delusion. If delusion is there, then diagnosis is persistent delusional disorder. PDD. PDD most common is 40 years, around middle age. Just like depression, most common age was middle age female. Okay, these are 40 years. Okay, persistent delusional disorder. Only delusion is there. But I will add one more point that in PDD, occasional hallucination may be present. Occasional hallucination may be present. Clear? Now, if suspiciousness is given in the question and they give delusion is there, and hallucination is also there. Delusion is there plus hallucination is there, then paranoid schizophrenia. I am deliberately avoiding the duration criteria. If patient, they gave that patient is having this since adolescence, no delusion, point it out, no delusion, no hallucination, means suspiciousness is there, little bit suspiciousness. Sometimes our friends are also suspicious. You give 2 movie ticket, your girlfriend denied to go to movie and you thought that I should give my friend these movie ticket. He said, why me? Means he is suspicious of friendly act. That is paranoid personality. So point it out, very, very important catching point. Whenever personality disorders are there, these symptoms usually start in adolescence. Now solve this question. In this, they have given the age is 40 years. Patient is suspicious. Yes, fight with him without any reason. Suspicious. But these symptoms are present only for 1 year. Means these symptoms start at the age of 39. So personality disorder is ruled out. Yes, personality symptoms should be present since adolescence. And moreover, there must be delusion. There should not be delusion. Okay, but in this you can easily rule out. Bipolar, we have discussed, you can easily rule out. Schizophrenia, I told you, yes, delusion plus hallucination. In this, they have given suspiciousness is there. He is suspicious, delusion of persecution, that my family member, my neighbor want to kill me or want to harm me. Yes, no disorganized behavior, no manic symptom, no hallucination. The answer would be persistent delusional disorder. Now, please tell me answer. Okay, everybody. In the same question, if I say occasional hallucination, what would be the answer? Yes, delusion plus occasional hallucination may be present, diagnosis would not be changed. Diagnosis would remain same. Persistent delusional disorder. Diagnosis would remain same. Persistent delusional disorder. But in the same question, if I remove this word no, yes, hallucinations are present for last 1 year. Okay, same. Yes, sometimes they will not mention that it is present for 1 year. Simply they say hallucination, or they will put this hallucination in the middle of question. Now what would be the answer? Please tell me. Yes, in the same question they gave that 1 year, for 1 year patient is having delusion and hallucination. For delusion and hallucination for more than 1 month, paranoid schizophrenia according to ICD 10. ICD 10. So what is the difference? Yes, I will discuss shortly. Yes, so same question, answer would be yes, schizophrenia. Okay, only one word is changed, answer is changed. Very good. लिखिए. Yes, answer is B. So this flowchart will help you to solve many questions. Now, this is a diagnosis ATPD. Before going to this, I will point out if a patient is having delusion, hallucination, negative symptoms, disorganized symptoms, disorganized or formal thought disorder, yes, catatonic symptoms. Yes, I'm not mentioning so much. Most of time you will find delusion, hallucination, negative symptoms, formal thought disorders. If these symptoms are there for more than 6 months, means these symptoms, to be more specific, yes, 2 or more than 2 symptoms. 2 or more than 2 symptoms for more than 6 months, diagnosis is schizophrenia. Yes, if these symptoms, 2 or more than 2 symptoms, 1 month to 6 months, diagnosis would be schizophrenic. Schizophreniform disorder. Schizophreniform disorder. If these symptoms are less than 1 month, only one symptom is sufficient, less than 1 month, then is brief psychotic disorder. Brief psychotic disorder, other name is acute psychosis. In ICD, the name ICD 11 or 10, the name for the same thing is given ATPD, acute transient psychotic disorder. Okay, acute and transient psychotic disorder. So in means if less than 1 month, diagnosis is ATPD. In this question, catching point is a boy has since last 2 days, yes, feels that people are abusing him. He hear faint voices, means hallucination is there, aggressive behavior is there, fever is there for 2 days. So point it out, fever is stressor, not a cause. It is stressor. And we found that ATPD usually follows stressor and fever is common stressor. So don't get confused that it's having organicity. Okay, it act as a stressor. Now patient is muttering to self, means patient is having, yes, psychotic symptom. So this is less than 1 month ATPD. Okay, ATPD. So this discussion I have taken by DSM-5. Although ICD 11 little bit difference is there, but if you remember like this, you will be able to solve most of the questions. Clear? Now, good prognostic signs of schizophrenia are all accept. Yes, acute onset is good prognosis, good prognosis, poor prognosis means insidious, gradual onset. Family history of depression, good prognosis. Family history of schizophrenia. This is very, very important. Highlight it. In questions, sometimes they will give family history. Other disorders, you will find if family history is there, prognosis is good or bad, like that. Just like in pathology also. But in schizophrenia, if family history of depression is there, mood disorder is there, prognosis is good. But if family history of schizophrenia is there, prognosis is poor. So this is very important. Many times questions are asked. Females are having better prognosis than male. Now, living in developing country is a poor prognostic factor. Poor prognostic factor. This is recent change. Synopsis 12th edition, they have clearly given that developed countries are having better prognosis. So old question, if you will see, you will find that yes, living in developing country is good prognosis, but now latest edition of synopsis says that it is poor prognostic factor. Now, this question, 55-year-old man with chronic schizophrenia was found to be maintaining abnormal posture for a long time. If patient is maintaining abnormal posture spontaneously, yes, this patient is maintaining spontaneously, that is posturing. That is posturing. But in the same question, if they give that chronic schizophrenia, you are doing passive movement. Passive movement. Suppose this patient is sitting comfortably in the ward and you go and you start examination, you are doing passive movement. If I do myself active movement, if you do, this is passive movement. If you are doing passive movement, okay, and you feel no resistance, passive movement, no resistance, and you left the patient in abnormal posture and patient maintain abnormal posture. Patient maintain abnormal posture. Then the answer would be, yes, the same image. The answer would be catalepsy. Catalepsy. Passive movement, resistance present. Resistance present. Yes, Ashutosh, good. Correct answer is A. Yes, resistance present and patient maintain abnormal posture. Patient maintain abnormal posture. The answer would be waxy flexibility. Now understand. In the same image, if they give this abnormal posture is maintained after passive movement by examiner, and during passive movement there was resistance, just like you are bending wax candle, the answer would be waxy flexibility. In the same question, they say that this abnormal posture was maintained after passive movement and during passive movement there was no resistance, the answer would be catalepsy. And if they say the patient maintained this abnormal posture spontaneously, you are not doing anything, just like in this question. Just like in this question, you go to ward and you found this person standing like this, this is posturing. So in this answer is posturing, but the same image, different answer may be there. What about cataplexy? Cataplexy is sudden loss of muscle tone. Sudden loss of muscle tone. Okay. Seen in narcolepsy. Narcolepsy. Mnemonic. लेप्सी में लेप्सी नहीं होती. लेप्सी में लेप्सी नहीं होती. लेप्सी में क्या होती है? प्लेक्सी, sudden loss of muscle tone. One question is also asked, clinical scenario they will give and they will tell you that there is no loss of consciousness. In cataplexy, there is no loss of consciousness. Point it out. No loss of consciousness. Patient is standing, suddenly fell down. If suddenly fell down, you will think of seizure. Yes. So, in medical condition, in that there would be loss of consciousness. But in cataplexy, there is no loss of consciousness. Point it out. Seen in narcolepsy. लेप्सी में लेप्सी नहीं होती. Yes. ये क्वेश्चन आया था FMGE में recently. Patient present in ward when asked what is your name, patient also says what is your name. Where do you live? Where do you live? You must have played it with your girlfriend. Yes, boyfriend. That is copycat. Actually, this in psychiatry is seen in catatonia, and this is called echolalia. Lalia means language. Language. Echo of language means mimicking examiner's speech. Mimicking examiner's speech. Yes, echopraxia. Praxia means motor movement. Motor movement. Echo of motor movement. Suppose our HOD entered the ward and he did like this and this. The patient did the same thing, this, and HOD became angry. Put this patient on ECT. Current लगा दो इसको. Okay, actually he is not angry. He recognized, the HOD recognized that the patient is having echopraxia. Echopraxia is commonly seen in catatonia. Catatonia. Other features also suggestive of catatonia were present, and the best treatment of choice for catatonia is modified ECT. Modified ECT. But question was asked, what is the initial management? Initial management or medical management? Then the answer would be injection lorazepam. So you will try to manage these symptoms with the help of lorazepam. If patient is not improving, you will put the patient on ECT. So these are catatonia. What are the symptoms of catatonia? I told you only few symptoms: posturing, catalepsy, flexi-flexibility, echolalia, echopraxia. These are symptoms of catatonia, and catatonia best treatment is modified ECT. What about perseveration? This is very important point. Question has been asked. What is perseveration? If I ask you, what is your name? You say, my name is Mahesh. Where do you live? My name is Mahesh. What is your father's name? My name is Mahesh. Means same phrase, same thought is continued beyond the point of relevance. Most of time you will find the same thing. What is your name? My name is Mahesh. What is your father's name? My name is Mahesh. Where do you live? My name is Mahesh. Sometimes in question you will find, what is your name? Patient would say, Mahesh, 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 Mahesh. That is also, yes, perseveration. That is also, yes. थैंक यू आशुतोष. 26 पेजेस से सारे क्वेश्चंस हो जाते हैं. डियर, साइकेट्री बड़ी छोटी सी है, बट इसमें वर्डिंग का चेंज होता है. दैट्स व्हाई आई एम टेलिंग यू लिटिल बिट चेंजेस आर देयर. यस, थैंक यू फॉर योर कमेंट्स. बट साइकेट्री एक ऐसा सब्जेक्ट है जहाँ से तुम सारे क्वेश्चंस, सारे मतलब नंबर्स स्नैच कर सकते हो वेरी इजीली यदि तुम्हें कंसेप्ट पता है. और छोटा सा सब्जेक्ट है, उसको वाइजली हम डिस्कस कर रहे हैं. जहाँ जहाँ पे कैचिंग पॉइंट्स आ रहे हैं वो मैं तुम्हें बता रहा हूँ. अभी आगे थोड़े से वो कैचिंग पॉइंट और बताऊंगा जहाँ पे तुम्हें सिर्फ एक वर्ड इज सफिशिएंट टू मेक द कंप्लीट डायग्नोसिस ऑफ अ लॉन्ग क्लिनिकल सिनेरियो. ओके, यस. मिमिकिंग एग्जामिनर्स स्पीच हो गया. परसिवरेशन हो गया. परसिवरेशन सजेस्ट ऑर्गेनिसिटी. ऑर्गेनिसिटी. परसिवरेशन सजेस्ट ऑर्गेनिसिटी. What does it mean? Yes, ऑर्गेनिसिटी के बारे में बात करेंगे यार. ये अभी रिसेंटली FMGE में 2-3 क्वेश्चन आ चुके हैं इस पे, और बड़ा ही अच्छा कंसेप्चुअल टॉपिक है. 2-3 कैचिंग पॉइंट मैं तुम्हें बताऊंगा, जैसे मैंने तुम्हें प्रॉमिस किया है. आई विल टेल यू दोज कैचिंग पॉइंट. ये टॉपिक हर बार आता है, और एक कैचिंग पॉइंट है मैंने माइल्ड, ट्रांजिएंट, आफ्टर चाइल्ड बर्थ depressive symptoms are there. If after childbirth depressive symptoms are there and they suggest in a clinical scenario these symptoms are mild, means they will give clinical scenario in such a way that your heart would say these are very mild symptoms, and they will use the word mild. Yes, good evening dear. Mild, yes, mild, transient, within few days, 5 days. Yes, I told you, if you want to make the diagnosis of depression, duration of symptoms should be at least for 2 weeks. Although nowhere it is written that duration is the diagnostic criteria, but usually these symptoms start within few days, 5 days. So at 5 days you can't make the diagnosis of depression. So let's discuss. Yes, Normal vaginal delivery, woman brought to casualty by her husband. He reported she has mild tearfulness. There is history of loss of appetite, difficulty in sleeping, feeling low. These are depressive symptoms. General physical examination is unremarkable, means they want to rule out organicity. Okay, best diagnosis is postpartum blues or baby blues. Okay, again I am telling you mild. In the same question, if they give there is suicidal, Rajneesh, very namaskar beta, suicidal ideation, suicidal ideation. In the same question, if suicidal thoughts are there, yes, diagnosis would become postpartum depression. Okay, means postpartum depression, you will find suicidal ideation, excessive guilt, anhedonia. That will suggest you severe symptoms postpartum depression. Postpartum psychosis, name itself tells you patient would have delusion, hallucination. Delusion plus hallucination. Okay, postpartum psychosis. Clear? Delusion or hallucination, not only both must not be there, delusion or hallucination. What is the content of delusion and hallucination? Sorry to be distracted. Yes, what is the content? That I have given birth to a demon. Yes, my child is not my child. My child was born dead. So patient is believing, false, firm, unshakable belief that my child is demon. So patient may harm the patient. So in treatment of postpartum psychosis, you will keep in mind separate baby from mother. If you feel that there is chance of harm to baby, you will separate. Okay. Postpartum anxiety, no terminology like this. So questions are asked, you can easily, yes. Postpartum depression, usually these symptoms appear within 3 months. 3 months. Okay. 3 month. Duration criteria is not the diagnostic importance. Duration may vary. Okay. But usually 3 months के अंदर depressive symptoms होते हैं. Okay dear. This question recently asked. Yes. Schizophrenia. Patient was started on olanzapine, no benefit at adequate dose given 4 to 6 weeks. No benefit 4 to 6 weeks. If two antipsychotics given 4 to 6 weeks, no benefit, diagnosis is treatment resistant schizophrenia. So if two antipsychotic you tried for 4 to 6 weeks, patient is not improving, the diagnosis would be treatment resistant schizophrenia, and the best drug is clozapine. Yes, clozapine. Clozapine questions are asked. I told you it is having antisuicidal property. It causes increased salivation. I usually remember whenever you do blush with close-up, clozapine as close-up. Whenever you do blush with close-up, there would be excessive salivation. If you do blush very rapidly, it will appear just like you are having seizure. So dose dependent side effect of clozapine is generalized tonic-clonic seizure. Yes, most dangerous side effect is agranulocytosis. Yes, हम यहाँ पे लिखेंगे, next लिखेंगे dangerous side effect is yes, that is agranulocytosis. This question was asked, yes, that you will do TLC, DLC every week for 6 months. How many months? 6 months. This question has been asked in AIMS. Okay, got the point? Yes, recently asked question. High potency antipsychotics are D2 antagonist. Yes, D2 antagonist. Antipsychotics are D2 antagonist. So it may cause extrapyramidal symptoms. Yes, I gave antipsychotic, sent the patient took first dose, immediately he developed a prolling of eyeball. that is acute muscle dystonia. Acute muscle dystonia. Acute means within few days. Yes, immediately started after giving the antipsychotic. Muscle dystonia, disturbance in tone, uprolling of eyeball. Yes, torticollis, log jaw. These symptoms are there. These are acute muscle dystonia. Yes, just acute muscle dystonia. This is earliest side effect. And nothing to worry, you will give, yes, injection promethazine or injection benztropine. Question has been asked recently on promethazine. Yes. Okay, injection promethazine. Is other than that, you will find that patient on antipsychotic may develop other extrapyramidal symptoms just like akathisia. Akathisia. What is akathisia? Patient is feeling restlessness. Let me tell you in a clinical scenario how questions are asked. The patient is there, you started antipsychotic, and after 2 weeks, 3 weeks, patient came to for follow-up. Patient said, Doctor Saab, I am feeling better. The family member also said, Doctor Saab, he is quite better. But Doctor Saab, he is not sitting at one place. He is roaming around in the home. He is going out, coming in, going out, coming in, going up, down. Yes, he is not sitting at one place. Means family member told you, objective restlessness. Objective restlessness. Yes, patient would tell you, Doctor Saab, yes, I am feeling very, very restless. Means subjective. Objective and subjective restlessness. That is akathisia. No need to worry. Give propranolol beta blocker. So beta blocker is given for akathisia, but in this scenario, yes, injectable haloperidol given. Patient developed uprolling of eyeball. Yes, this is acute muscle dystonia. You will give immediately injection promethazine. You will ask me, sir, it should be given IM or IV. Sometimes you may get confused. Few places it is written IM, it is written IV. So no need to be confused. If you want quick result, IV. And if you want little bit later, you can give IM. Depending on the setup you have, you can give both IM or IV you can give. Okay. So no need to worry. They don't ask like this. They simply ask simple question. This was question in IISCT. Yes, it's not a normal side effect. Okay. Conversion disorder, you all know in conversion disorder there is stressor and there is a neurological symptom which cannot be explained. Okay. So in this question clearly said that after antipsychotic it developed. Definitely answer would be yes, acute muscle dystonia, injection promethazine. Okay. यस अल्कोहल तुम्हारी लाइफ का सबसे प्यारी चीज़, प्यारी चीज़ जो तुम्हें नहीं पीनी चाहिए पर तुम मानते नहीं हो. यस, अल्कोहल जब भी लोगे it will cause B1 deficiency. So whenever you take alcohol, don't take alcohol. But if you take alcohol, take thiamine in the morning, because all the complications, not all, most of the complication of alcohol are due to B1 deficiency. And the catching point is that whenever you will find any question on the treatment of alcohol related disorder, the treatment modality would be thiamine. Delirium tremens, you should give thiamine. Alcohol withdrawal, you will give thiamine. Wernicke's encephalopathy, you will give IV thiamine. Korsakoff psychosis, you will give oral thiamine. So all disorder related to alcohol treatment part is thiamine. Mnemonic for Wernicke's encephalopathy is गोवा. Yes, गोवा जाते हो, अल्कोहल पीते हो और कुछ पहनते भी नहीं हो, वियर नहीं, कुछ भी नहीं पहना. ओके, नहीं के पियर. ओके, तो यस, G for global confusion इस क्वेश्चन में दे रखा है confusion. O for ophthalmoplegia, due to sixth nerve weakness, ophthalmoplegia would be there. A for ataxia would be there. Yes, ataxia, nystagmus may be there. This is typical clinical scenario of Wernicke's encephalopathy. Mnemonic for this WM. मेमिलरी बॉडी। ओके, नेचर ही अपने आप ऐसे ऐसे नाम बनाता है, गोवा, वर्निकी, मेमिलरी बॉडी, है ना, कपड़े नहीं पहने, गोवा गया, अल्कोहल पिया, है ना। तो अब इसमें मेरी गलती कुछ नहीं है, बाइलेटरल मेमिलरी बॉडी लीजन। ओके, ओके, अल्कोहल नहीं लेना यार, अल्कोहल इज नॉट ए गुड थिंग, you know. Let me, because yes, I have taken a little bit more time, but yes, you know, now we are trying to increase dopamine at mesolimbic pathway. All the substance, alcohol, opioid, cannabis, cocaine, all increase dopamine at mesolimbic pathway. Mesolimbic pathway is final reward pathway. But we found that few activities can also increase dopamine at mesolimbic pathway. So why are you taking these things? Why are not you searching for that kick? That is dopamine. Yes, that can be achieved. The same kick can be achieved by victory. And now you will achieve that kick only by clearing this exam. This is the last exam of your life. Think like that. Okay? Definitely, in medicos, every day there is an exam. Okay? But I feel that this last month is sufficient to clear your exam if you are positive. हमने कछुए की कहानी सुनी थी, कछुआ और खरगोश था, उसमें कहते कछुआ बनना है, हमने धीरे धीरे चलता रहना है, बस चलते रहना है। मैं कहता चलना है, हमें तो अब रैबिट बनना है, हमने कछुआ नहीं बनना, हमने रैबिट बनना है। हमारे पास गैजेट्स हैं, हमारे पास अब मोबाइल है, हम अलार्म लगाएंगे, सोएंगे नहीं। तो बस 1 महीना लास्ट का मुझे दे दो, सोना नहीं है, कछुआ नहीं बनना, हमें तो रैबिट बनना है, और बिना सोए बिना रेस्ट किए तब तक दौड़ेंगे, उसके बाद रेस्ट कर लेना। ठीक है? सो फॉर दिस टाइम पीरियड, यस, बी पॉजिटिव, कंटिन्यू योर हार्ड वर्क। अब तक करते आ रहे हो, नहीं करते आ रहे हो, डजेंट मैटर, करा तो अच्छी बात है, फिर 200 पार भी तो करने हमने। ठीक है? तो नहीं करा तो भी एग्जाम तो क्लियर कर सकते हो ये लास्ट मंथ में, तो बी पॉजिटिव फॉर दैट। ओके डियर फ्रेंड्स, सो वर्निक इज एंसेफेलोपैथी। नेक्स्ट इज, मैंने तुम्हें बताया था एक कैचिंग पॉइंट। देखो, they will give a long clinical scenario. Let me tell you, there is a patient after road traffic accident, there was hip fracture, patient was admitted, he was operated, after operation he was shifted in ICU. In ICU, patient is very aggressive, pulling cannula, pulling nasogastric tube, he is abusing everybody, he is suspicious of family member, he is visualizing something. All these things are there. I am saying that till now there is no catching point. Now they said patient is not oriented to time place. Patient is not oriented, or patient is confused, or patient has altered sensorium. Patient has altered sensorium, or clouding of consciousness. If these terminology you find, okay, acute, I write here acute, means for few days acute, without second thought the answer would be delirium. In the same question, if they gave these terminology after stopping of alcohol or history of alcohol, diagnosis would be delirium tremens. Remember this point? Okay. So in this question, let me explain. 65-year-old woman, operated hip replacement, is agitated, confused, she is unarousable during the day, yes, but remains awake during the night. Yes, there is reversal of sleep. Okay, she is distressed, oriented to person but not place a time, altered sensorium. So I found confused, altered sensorium, without second thought, answer is delirium. Sorry. In the same question, if I add that she is chronic alcoholic, then autonomic disturbance would be there and the diagnosis would become delirium tremens. Yes, medical cause of mental illness or organicity. Organic cause or organic mental disorder. Organic mental disorder, new name is neurocognitive disorder. Yes, neurocognitive disorder. Neurocognitive disorder. Okay. In neurocognitive disorder or organic mental disorder, dementia, delirium, these are common organic mental disorder. You all know delirium is acute. Delirium is acute. I just told you acute. Yes. So acute onset suggest organic. Yes. Dementia. Dementia occur in old age. So old age suggest organicity. Loss of consciousness, clouding of consciousness suggest organicity. Visual hallucination. Now I write visual hallucination suggest organicity. Okay. Perseveration. What is your name? My name is Mahesh. Where do you live? My name is Mahesh. What is your father's name? My name is Mahesh. Perseveration, organicity. Labile effect. Yes, this question has been recently asked in FMGE, so this can be repeat with little bit modification. Labile effect means person is smiling, suddenly start crying. Suddenly is crying, suddenly start laughing. Just like you must have seen few movies, yes, in which a person is laughing, suddenly start crying. That is labile effect seen in dementia and suggestive of organicity. Okay. Auditory hallucination commonly seen in psychiatric disorders. Okay. And visual hallucination, organic mental disorder. Okay. Clear? So answer is D. Answer is D. Now, yes, Coca-Cola. My favorite mnemonic, Coca-Cola was having cocaine previously when cocaine was legal. Okay. If you drink Coca-Cola so frequently, your tongue would be jet black. If you are taking Coca-Cola again and again, jet black tongue. So cocaine can cause jet black tongue. Coca, Coca, ni tera Coca hoka. You must have heard that song. Coca in Punjabi, nose pin. Nose pin, we wear nose pin at different place. A girl is wearing at nasal septum. So nasal septal perforation. Okay. So cocaine cause nasal septal perforation, jet black tongue. Okay. And there is increase BP, increase pulse rate. Yes, increase BP, increase pulse rate. Patient may feel that cockroach are crawling over the skin or under the skin. That is tactile hallucination. Tactile hallucination. Tactile hallucination. So typical example of cocaine intoxication. A question was asked, cocaine intoxication. Yes, cause all except option A, bradycardia, tachycardia. Yes, it causes tachycardia, not bradycardia. Cocaine inhibit reuptake of norepinephrine and dopamine. Norepinephrine increases vasoconstriction, increase heart rate, hypertension. So hypertension, increased heart rate, vasoconstriction would be there in cocaine intoxication. Got the point? Formication, crawling over the skin, that is called, yes, tactile hallucination, formication, or the Magnan phenomena. Okay, good. Now, this is typical hoarding disorder. Hoarding means to accumulate. Hoarding means to accumulate. Yes, invaluable item. Point it out. Invaluable items. Yes. Ill girl said, sir, my mother is होर्डिंग all jewelry, I said ना पगली, वो होर्डिंग ना है. Hoarding clearly said that invaluable item, not useful. Yes, a person is accumulating all the newspaper for last 20 years, empty bottle of water. Before discarding, patient feel that this can be used in later part of life, so will not be able to discard. The whole house would be full of clutter. There would be no place to live. This is hoarding disorder, and we found that hoarding disorder least responsive or less response to ERP. Yes, poor response. Poor response. This question has been asked to exposure and response prevention. Now question, 62-year-old man presented in geriatric OPD with complaint of his inability to throw things away, to accumulate. He keeps collecting useless things like old papers, magazine, clothes, rubber bands, okay, etc. Whenever his family member attempt to declutter, हटाना हटा चाहती है, or at least organize those things, he would become agitated and argumentative and says that he may need them later. Okay, what is the most likely diagnosis? Answer is hoarding disorder. Clear? Now, trichotillomania is a part of, yes, trichotillomania previously was impulse control disorder, previously ICD 10. But ICD 11 trichotillomania is OCRD, obsessive compulsive and related disorder. So, 2-3 things you will remember. OCRD, yes, trichotillomania is a part of OCRD. Hypochondriasis is also part of OCRD. Point it out. Okay. Yes, this question was asked in FMGE. They gave this trichophasia, trichobezor, means person is pulling hair and eating. Yes, pulling hair, trichotillomania, eating, trichophasia, intestinal obstruction, trichobezor, this, and surgeon operated. Now this surgeon will refer this patient to which department? This was a question in FMG. Definitely psychiatry department. Okay, because this trichobezor would be treated by surgeon. After that, this should not develop again. So we will treat the patient by habit reversal therapy. What is the treatment of trichotillomania? Habit reversal therapy. HRT. Question has been asked. Yes, this is very, very important. 2-3 times questions are asked. Let me make a flow chart for you. This will help you. Okay. Yes. Yes. Suppose eating disorder, question is asked, eating disorder, and they give patient is taking less food, less amount of food, restriction of food. You will search what is the reason the patient is not taking food. If patient is not taking food because patient don't like smell or taste of food, then it is avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder. If patient is concerned with body image disturbance, patient feel as if patient is fat, she is fat. In spite of having normal shape or normal figure, she is feeling that she is fat. Whenever she look at mirror, she feels that she is fat. That is, yes, that is body image disturbance. Then it is, and BMI is according to ICD 11. ICD 11, BMI less than 18.5, diagnosis would be anorexia nervosa, restrictive type. Got the point? So if patient is taking less amount of food, two possibility, avoidant restrictive food intake disorder. If body image disturbance, anorexia nervosa, restrictive type, BMI should be less than 18.5 according to ICD-11. If patient is eating large amount of food in short time, large amount, yes, that is called binge eating. Yes, हिंदी में कहते हैं ठूसना. You must have seen मोटू पतलू, ऐसे ठूसता है ना वो, that is binge eating. After binge eating, no purging. Diagnosis would be binge eating disorder. If large amount of food, binge eating is there followed by purging, then two possibilities are there. If BMI is more than I write here, BMI is more than 18.5, then it is bulimia nervosa. And if it is less than 18.5, then anorexia nervosa, binge eating purging type. So if binge eating purging is there in the question, point it out, recently asked question, if binge eating and purging is there, yes, you will search for BMI. If BMI is more, then bulimia nervosa, less, it is anorexia nervosa, binge eating purging type. If they don't have mentioned that, definitely you will think of bulimia nervosa first. Okay. So in this question, yes, they have given 16-year-old girl BMI 21. So this is BMI. Yes, can you tell me the answer? BMI 21. Yes. So since week eats excessive amount of food but feels ashamed about losing control, or yes, can't control. Physical show enlarged and firm parotid glands bilaterally. Yes, infection due to infection. There are erosion of the enamel when they induce vomiting again and again. Yes, purging means induce vomiting, laxative. Okay, exercise hypergymnasia they can do. Yes, this knuckle will strike. Okay, on the incisor there would be lesion on knuckle, that is callus formation on the knuckle. That is called Russell sign. This Russell sign may be seen in both anorexia nervosa and bulimia nervosa, but in this question the clinical scenario suggests bulimia nervosa, so answer would be bulimia nervosa. Very good. Yes, 16-year-old female was referred to irresistible urge to eat craving followed by episode of self-induced vomiting. Patient also on appetite suppressant. Most likely diagnosis, yes, bulimia nervosa. Okay. Yes. You will remember EEG waves, really difficult, but you must have read in neurology also. Mnemonic is BAT-D. BAT, जैसा कि बैट बॉल का बैट होता है. Yes. Okay. Now, if you are awake and if I do your EEG, I will find beta waves. B को मैं याद रखता हूँ honey bee frequency is very high frequency, low amplitude. Yes. Now you close your eyes and you are awake, alpha waves. Closed eyes. Now you go to light sleep, LIGHT, light sleep, theta wave. Deep sleep, D4 deep, D4 delta waves. Now I make mnemonic DDD 3D movie. So frequency of delta wave is 1 to 3 hertz, large amplitude. Okay. So if we are awake, we do EEG, beta waves. Close our eyes, alpha waves. Yes, go to light sleep, theta. Deep sleep, delta. Okay. If you are awake, in EEG, you will find beta waves, high frequency, low amplitude. You are awake, your eyes are moving, electrokilogram will show fluctuation. This question was asked, they will give you either this or this, and they will ask which phase of sleep awake cycle is this. So you must know, when you are awake, your mind is having, yes, continuous thought, beta waves are there, eyes are moving, electrokilogram will show fluctuation, my muscles are moving, electromyogram will show fluctuation. All these three fluctuation, awake. NREM. Yes, this is deep sleep, light sleep. This is NREM sleep. I write here NREM sleep. After NREM sleep, there is REM. There is REM sleep. Okay. Clear? So in REM sleep, there is sawtooth pattern of EEG waves. Okay. REM, all muscles are paralyzed. Remember this. All muscles paralyzed except two places. One is eye. rapid eye movement. All muscles are paralyzed but eyes are moving. Yes, जब तुम सुनहरे सपने देखते हो रात को सोते हुए, सुनहरे सपने देखते हो ना, तो that is सुनहरे सपने is REM and your eyes are moving and there is penile erection. Okay, so now you can correlate. In this, eyes are moving, so electrocardiogram will show fluctuation. The whole body is paralyzed, so electromyogram will show no fluctuation, flat. So if electromyogram, no fluctuation, yes, REM. NREM, no rapid eye movement, yes, delta waves, deep wave, deep sleep. Electrocardiogram, eyes are not moving, no rapid eye movement, non-rapid eye movement. So fluctuation would be not be high. So electrocardiogram more or less flat like. Electromyogram, when you are in deep sleep, even then you are moving little bit. So some fluctuation would be there. So NREM, there would be, yes, mnemonic. If all three fluctuation, awake. If rapid eye movement, there would be eye will be movement and whole body would be paralyzed, flat electromyogram. If flat electrocardiogram, no rapid eye movement. Got the point? You will be able to solve questions. Yes, involuntary, yes, 2-3 questions are left. Yes, recurrent intrusive thought, image, impulse coming in my mind. I want to stop these thoughts. My hands are dirty. My hands are dirty. These thoughts are coming in my mind. I want to stop these thoughts. Unable to stop these thoughts. I will develop anxiety. Will go to washroom, wash my hand. Will feel relaxed. The thoughts which are coming, that is obsession. And washing is a compulsion. Obsessive compulsive disorder. You ask me, sir, these thoughts are your own thought or somebody else has inserted these thoughts? I say, no, I know these are my own thought. What I said? In OCD, thoughts are recurrent intrusive, my own thought. OCD, my own thought. But if patient says that somebody has inserted these thought in my mind, this phenomena is called thought. Very good, you have given correct answer. Thought insertion, and this is seen in schizophrenia. So in this question, the answer would be schizophrenia. Yes, you gave correct answer A. Yes, schizophrenia. But in the same question, if I change only one line, he start believing that these thoughts are my own thought. These thoughts are my own thought. Then it is OCD. Most common obsession, yes, contamination, followed by pathological doubt. Okay, most common obsession. Most common compulsion, checking. Most common compulsion, checking. Treatment, best is ERP, exposure and response prevention, then CBT. Okay, if question is asked, want to choose exposure and response prevention should be better answer. Okay, pharmacological treatment, SSRI, then clomipramine. Okay, SSRI, clomipramine. Yes, after road traffic accident, severe means very traumatic event, that is bomb blast, severe accident, rape, earthquake. If after that patient visualize the same scene again and again, after this severe traumatic event, patient has flashback, nightmares, avoidance. Avoidance means not going to that place where accident occurred, not sitting in the car means avoidance. Hyperarousal, decreased sleep, irritability is there. If these symptoms are there less than 1 month, then it is acute stress disorder. More than 1 month, PTSD. Both are questions. Yes, both are question. Very good answer is PTSD. Okay. Now, Last question. 3-year-old girl is taken to doctor by her parents because they are having trouble with her, as her teacher has reported that she does not pay attention. Attention is not there, okay. Does not play or socialize with her classmates. No social interaction. First point is social interaction is less. Ignores her parents at home. Constantly draws circle and avoid making eye-to-eye contact throughout the interview. Means constantly draw circle, repetitive behavior. Repetitive behavior. If repetitive behavior is there, yes, social interaction is less, diagnosis would be autism spectrum disorder. They deliberately mention the word initially attention, because when we will see attention, we will immediately think of attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder, patient would be hyperactive, inattention would be there, patient would make frequent mistake, will not sit at one place, will disturb other students, will interfere the conversation of mother, yes, blurt out answer without completion of before completion of question. ADHD, different scenario would be there. Rett syndrome is X-linked dominant. Okay, more common in female than male. Previously we used to say this is exclusively found in females, but now we say more common in female. X-linked dominant. Recently asked, trofinetide drug has been found effective. Trofinetide drug approved for Rett syndrome. Okay, so these are the questions, recently asked questions. Most of the childhood psychiatric disorder are more common in male, except few, just like Rett syndrome, X-linked dominant, more common in female. Okay, so now on 2nd July there is a major mock test 2.0, and at 5 p.m. onwards we will go live discussion of all those questions. As you know, after appearing in grand test or any test, if you don't analyze or don't correct your mistakes, the outcome is not so good. So whenever you attempt any exam, means mock test, grand test, yes, after that invest some time so that you can point out what mistakes you have committed at this time, so that those mistakes can be avoided in further exam, means main exam. So the main purpose of these tests is to correct ourselves at this point so that we can avoid the mistake in future. Okay, and the best part of this would be discussion by the faculty immediately after the test. So they will also tell you how to exclude answer, that will help you to get maximum benefit of this mock test. So do join and boost your preparation. Remain remain connected. Yes, best of luck for your exam. Thank you for patience listening. Gadyaman?